All right, we should be good to go. Brother Powers, I see you muted, but prayerfully everything is okay. We've got one person and we should be live on YouTube prayerfully. And we are about to get started, and you can let me know if I need to do something else to make YouTube work. I think I saw it on the other computer. But anyway, I am glad today that this is being recorded on YouTube, one, so that it can be shared. Now, I'm advising you to please get your notepad. If you're out there on the YouTube line, get your notepad as well and your pens, because everything that we present today is not going to affect everyone. But I want you to make a note of what does as we go along. So when we get to the Q&A, you can ask. And then when you play it back over an area that you weren't familiar with, you can know what particular section you're looking for. Okay. So let's go ahead and get started. All right. So you can see my screen here. This is our original presentation. And, okay, who is the best audience for this presentation today? People who are about to turn 65 in the next few months, people who have already turned 65 this year, people who have been on disability for 2 years and 1 month, or you're just about to get there, and people who are already on Medicare, whether due to age or disability. And then most importantly, family members and caregivers of everyone listed above. It really does take a whole village to understand Medicare. And I want to start with some tips. And one of the reasons I want to start with tips is we're going to get into the basics, but these are questions and issues that come up a lot when we're doing counseling. And we definitely want to make sure I address those things first, and then we can get into some of the other things. Okay. One of the things that I always get asked, Medicare is not Medicaid. Okay. It is not Medicaid. Let's look at a good way to clue that. Medicaid provides aid to people in need that are below a certain income level, and it is a state-based program. Look at how I pulled out those last 3 letters, K-aid. So Medicaid provides aid for people that are below a certain income level, and it's a federal program, but it's administered through the states, and it's administered differently through every state. Medicare, which is what we're talking about today, helps to take care of health concerns for those that qualify, and it is a federal-based program and administered federally. You can qualify for both, but you do have to qualify for each one separately. All the commercials and the junk mail and the phone calls that are saying you can get back $144 a month or $148.50 a month, that is pure hype for most people. They want you to call them so they can see if you qualify so they get the sale. Now, if you retire from here's some other good tips. If you retire from a company, your Medicare benefits are usually determined by the company. And there's several options, and they're never the same from company to company. They will either no longer carry you at all, and you'll have to decide on the Medicare plan, or they'll have a modified Medicare plan, and Medicare be primary, and the company's retiree insurance will be secondary. There may also be an extra premium for the company's portion, in addition to what you already will have to pay for Medicare Part B premium. And there are any number of modifications that different employees can have. Always consult your HR department before making that decision, okay? Now, our next one is, and I know this is not a word, but it is a huge, ginormous tip, okay? Medicare needs and Medicare costs are determined by the type of medication you take and the doctors you see, okay? And basically that means that it is extremely rare for any 2 people to have the same Medicare cost. What works for one person will not work for another. All right, excuse me 1 minute. I want to make sure, Brother Kevin, I don't know if you can hear me. Can you see it on YouTube? Because we definitely want that part to work.
Hey, you got me off mute.
Are you seeing it on YouTube?
I'm driving right now.
Oh, okay. Don't look.
Yeah, I'm driving to a pharmacy right now.
Okay, don't look. I'll check.
As soon as I get there, I'll check it.
Okay. All right. All right. Thanks. And just can give me a second. We really wanted the YouTube piece to work today. So give me just a second and let me see if I can see. Okay, it appears to be working, so they'll all wonder what that was about when they see it on YouTube. It didn't come up on my phone, but it is on my other computer, so we should be good. Here's the huge, ginormous tip, okay? Medicare, like I said, the Medicare needs and costs are determined by the type of medication you take and the doctors you see. So we hear people say all the time, well, I want the same benefits my neighbor got, or my husband got, or my uncle, or whatever. It's not possible unless there are two people who take the exact same medication and have the exact same doctors and the exact same illnesses. Everybody's Medicare will be different. Everybody's Medicare costs will be different. What works for one person generally will not work for another. And let's look at some of these traps, because there are quite a few of them. This time of year, if you qualify for Medicare or almost qualify, you are being bombarded with calls and mailing pieces. And sometimes you want to know, is this legal? You know, on our phone, we can block it. We can't block mail, unfortunately, not snail mail. But is it legal? So to explain this best, let's look at the companies that are calling or emailing you or mailing you by looking at the different ways you can enroll for Medicare. First of all, there can be between 25 to 50 different companies that can provide different levels of Medicare coverage. Some of them are names you already know. Blue Cross Blue Shield, Aetna, AARP, Cigna, Humana, WellCare. All right. And why does that make a difference? Most of these agencies sell all types of insurance. They sell, you had it when you were working. They sell employee health insurance, workers' comp, COBRA. They sell Medicare drug plans. They sell Medicare supplement plans or Medigap plans. They sell Advantage. They sell everything. What this means is if you ever had any type of relationship with any of these companies, they, in the fine print of what we sign, they can legally call you about any of the products that they sell. For example, if you had Blue Cross Blue Shield at work, for employee health insurance, you can be contacted by them for any other product, like their drug plan or their Advantage plan. They get a commission if you enroll. And unfortunately, you don't get any advantage just because you had that insurance with them while you were working. Sorry. All right, big trap. Absolutely, trap or tip. Absolutely no one is supposed to knock on your door ever. Okay. Those agents can be reported to the Medicare fraud line, which we will discuss in a bit. If your doctor has not, here's another tip. If your doctor has not given you a prescription for any of these braces, back brace, knee brace, I know we all got those calls. Their office is not going to have anyone call you to set it up for you. So please don't give any of these people your Medicare information. Okay. Next tip. If you are already on Medicare and have a prescription drug plan or an Advantage plan, and you say, I love my plan, I don't care about this open enrollment, I can keep what I got. It is important that you check to be sure that your plan still loves you, okay? During open enrollment. Why? Your plan could drop a medication that you're taking or that you were using, or your doctors can unenroll themselves from that plan. So we always encourage our beneficiaries, please call us and just check to make sure nothing has changed. Check during open enrollment to make sure whatever goes into effect January 1 is stuff that you want, that you need, that you can still use. Okay, another big tip or trap. The pharmacy that you are using may no longer be a preferred pharmacy with the plan. that means that your drugs can cost more at a pharmacy that you've been using. So you at Walgreens and you were paying $1 for the medication. Whoa, this year it went up to $12. What happened? Well, usually what happens is the insurance company no longer has a contract with that pharmacy. So these are things you don't want to find out as you get into the new year. You want to know beforehand. Now, looking at, my computer decides to move on. I love it when stuff gets stuck. There we go. All right, looking at some Medicare basics. We didn't mention the introduction, but I am a level 3 certified volunteer ship counselor with the Aging Commission of the Mid-South. And the Aging Commission used to be located at 2670 Union. So some of you all may have already heard it or visited over there pre-COVID, before the COVID craziness. And now they have relocated to 160 North Main Street on the 3rd floor. All right, and let's just take a brief look at their website. Bring it up here. Everybody still see my screen? Okay. With the Aging Commission, excellent. Okay. So here is the Aging Commission of the Mid-South. I'm getting feedback from somewhere, but okay. Here's the Aging Commission of the Mid-South. And over here on the left, you see the services they provide, in-home services. A lot of you may have heard of Choices program, a public guardianship. But one program that we're proud of under the Aging umbrella of the Aging Commission is the SHIP program. I click on that and you see it stands for State Health Insurance Assistance Program. And it's under the Tennessee State Health Insurance Assistance Program, a TINSHIP offers. I love this. This is our mission. We offer free and unbiased Medicare counseling to beneficiaries and their families. It's funded by a federal grant through the Administration for Community Living, and it's administered on local levels. There are 9 SHIPs in the state of Tennessee, and one is in Memphis. They're in several different cities and counties in Tennessee. We serve Shelby, Fayette, Lauderdale, and Tipton counties. And then this is some of the things that we help with: Medicare enrollment, drug plans, advantage plans, all of which we are going to talk about in a minute. Let's get back to our PowerPoint. Okay, so that's the Aging Commission. And I know and then we have, this is a dual city because the church that we're doing it for is in Mississippi. So we'll probably have some Mississippi people on. And we want you to know that too. SHIPs are in every state in the United States, which we'll mention. The SHIP in Mississippi is handled through the North Delta District, and it's under the Area Agency on Aging through the Mississippi Department of Human Services. And we can look at and these are the counties that they serve, and we can look at their website here. And as we scroll down, we see under here the different services, under the services for the frail elderly. Well, all of us elderly aren't frail, but we're blessed to be elderly. But under the frail elderly, one of the programs is SHIP. All right. And I know a lot of people have never heard of SHIP, but it is in every state, and their basic mission is the same, okay, in every state. And we are glad to be a part. All right, and getting back to our PowerPoint. And this is one thing, look at this card. This is the Medicare card that everybody on Medicare should have, okay? It has a completely different and random assigned numbers, identifiers that's 11 characters long, a combination of numbers and letters. The wonderful thing is they finally took our Social Security card off of Medicare. For those of the Medicare card, for those of you all who are just turning 65, that you didn't have to go through that craziness, but we did for a long time. I think up until year before last, when they finally took the Social Security numbers off. Okay. Now, wow. Okay, go back. While everyone will have this card, everybody is not going to use this card when they go to the doctor's office, hospital, or the pharmacy. Beneficiaries, Medicare beneficiaries that have an Advantage plan, which we're going to talk about in a minute, should put this card in a safe place like a drawer or your safe. Do not put it in your billfold, please. You put it away because you're going to use the Medicare Advantage plan card that your insurance company sent you. People who have original Medicare, you're going to use this card when you go to the doctor's office. If you have not received your card, and you should have, but if you have not received your card, there's a number you can call for Social Security or 1-800-MEDICARE, or you can create an account at mymedicare.gov. All right, now, Medicare is divided into several parts. I like to call them the Medicare alphabets, or the ABCDs of Medicare. First, we look at Part A. Move that up out the way. Everybody can see that screen. Part A, okay? What does Part A cover? Hospital. Premium free? Question mark, question mark, question marks. We do it for UK. Unfortunately, it is not free. If you worked at least 40 quarters or 10 years roughly and paid into Medicare, where they took Social Security and Medicare out your check, then it's not free. You just paid for it in advance. If you work less than 40 quarters, you could pay from $259 a month to $471 a month for this hospital coverage. And they have a deductible, a hospital deductible per benefit period of $1,484. Then after that, there's no additional cost for your next 60 days in the hospital, okay? And we look at the next part. Part B, so we're still on the alphabets. A, hospital. B, medical or doctor services, when you go to your doctor's office, okay? And that is payable by Medicare at 80%. The premium for 2021, the premium is $148.50 per month. If you don't qualify for some extra help, they take that out of your Social Security check. If you don't get Social Security check, you have to mail it in. For 2022, amazingly, it is projected to go down to be $144.60 a month. And I say amazingly because they rarely, like almost never go down. It usually goes up every year. And then there's a Part B deductible for 2021. It's $203 and it's projected to be $198 for 2022. Meaning when you go to the doctor's office, you're going to pay the first deductible, $203. Then after that, Medicare is going to pick up 80%. This is under original Medicare, which we're going to see in a minute. Our next alphabet, D. I know I skipped one, but I'm coming back. D, it stands for, it makes sense, drugs. These premiums vary based on the plan selected and based on your income. It is in addition to the cost of the medication. So you'll have a premium for your drug plan and then the cost of the medication. And the cost of the medication varies based on the insurance companies that you use and the pharmacy that you use, all right? Now, before we go to the Part C alphabet, I know we talked about different Medicare plans are provided by a lot of different insurance companies, Blue Cross, Cigna, Humana. But it is important to know that even though it's a lot of insurance companies, there are really only two ways to get Medicare. And think of it as two songs with different verses. All right, so if you're already on Medicare or getting ready to be on Medicare and you've gotten your Medicare and You handbook for 2021, there are some things we get in the mail that are relevant. Your Medicare and You handbook is one of them. If you've gotten that Medicare and You handbook, this information is on page 5. And it talks about the different types of different options. Option 1, original Medicare. Okay, under original Medicare, we just talked about the plans, right? So it includes Part A, hospital. Part B, medical insurance, our doctor's office. Part D, prescription drug plans. All right, now your card may come with A and B on it. If you get your Medicare card in the mail originally, it may come with A and B on it. You have to add D. D is not already automatically there. You have to add D, and D has a monthly premium. All right. remember, so then original Medicare Part B pays 80%. And we talked about that. And then when you go in the hospital, it's a $1,484 deductible. Who pays that? You do, unless the difference, like it's paying 80% on your doctor visits, the 20% you pay, unless you get a Medigap plan, which is also known as a Medicare supplement insurance plan. And they'll pay your hospital deductible, they'll pay your copays, your 20% copay after you meet the $203 deductible for this year, okay? But they are not free. So their premiums can run from $90 a month, $200, $300, upwards $400 a month. And most of these plans provided by different insurance companies are age-based plans. That means every year you age, the premium goes up. All right, so let's look at the next option, which is our other alphabet, Part C, and that's our Medicare Advantage plans. And they're sometimes called the all-in-one plan because they include A, hospital, B, medical, and D, drugs. It's all in one. All right, so let's talk a bit about Part C Advantage plans. They're like an HMO or a PPO, but it's still another Medicare health choice that you have as a part of Medicare. They're offered by private companies and they are approved by Medicare. Now, a lot of times I'll get people say, well, I don't have Medicare. I've got a Cigna Advantage plan. It's Medicare. They had to be approved by Medicare. And if you join an Advantage plan, in addition to providing hospital aid, doctor visits, B, and drugs, they usually offer extra services such as vision, hearing, dental, or health and wellness programs. And of course, original Medicare, as of yet, does not offer that. But they are under the umbrella of Medicare. They have to follow Medicare rules and regulations, but they can charge different copays. They can have different rules for how you get your services, like whether or not you need a doctor's referral. So that's not governed by Medicare. They have choices on that. And another reason we encourage you to go through open enrollment is their rules can change every year. So with them, it's just like employee insurance. You pay copays, just like you did when you were working. And for the medical part of the Advantage plan or the doctor visits, you still pay the Part D. I love it when my computer just jumps on its own. You still pay the Part B part, the $148.50 a month, unless you are receiving extra help, which we're going to talk about in just a minute. For the drug portion of the plan, many of these Advantage plans have a zero premium. You don't pay any monthly premium. You just pay your copays, all right? And you cannot get supplements. Supplements are not allowed under the Advantage plans. Tips that we recommend under Advantage plans: you be sure that all of your doctors are in the plan that you select. Don't certify it until you call your doctor. You call your doctor's office. Don't let the person signing you up call your doctor's office. You call your doctor's office, get to the insurance department, and be sure they understand it's a Medicare Advantage plan. If you just say, oh, I'm getting Cigna, they might think it's Cigna employee in coverage. It's, oh yeah, we take that. And then come to find out, they don't take Cigna Medicare Advantage plan. An Advantage plan is another Advantage plan tip. If you're looking at an Advantage plan, they are state-based plans. What does that mean? That means that if you're in Tennessee, they pay for services in Tennessee. If you're in Mississippi, they pay for services in Mississippi. Almost all of them, however, have out-of-state or travel coverage included in the policy. So you want to find out what are those out-of-state? I guess because I'm hitting this. Okay, I see. I'm hitting something. What are those cities? So if you go to Illinois to visit your grandchildren, you want to make sure that Illinois is one of their out-of-state travel cities that they cover. And we really, those of us who live right on this border of Mississippi, Arkansas, Tennessee, we definitely want to make sure that we can get covered in any of those cities. And Advantage plans are pay-as-you-go plans. Most of them do not have any premium. So usually if you don't go, you don't pay. All right, which is not a bad thing at all. So those are some Advantage plan tips that always comes up, and we like to make sure our beneficiaries are aware. So let's look at the enrollment period. If you're new, it's a 7-month initial, and that's different enrollment periods. This is the initial enrollment period. It is 3 months before you turn 65, the month you turn 65, and 3 months after. It tells you when the coverage begins. It begins the first of the month you turn 65 if you do it before. If you do it the month of, it begins the next month. If you delay it, it begins that next month after you signed up. But during this initial enrollment period, you can enroll, join Part A, Part B, and here's a huge part. There's no enrollment penalties, all right? And that is huge. I'm gonna let you see why in just a second. So other things about initial enrollment. You can enroll in everything, in A, B, you can get original Medicare with A, B, D, and pick up a supplement plan, or you can go with an Advantage plan, Part C. If you're already getting Social Security or railroad retirement, you're automatically enrolled, and they automatically give you Part A and Part B. If you're still working, if you're getting extra help, you might not need that Part B. So you need to really be on top of, call us, call SHIP. That's what we're here for. So we can let you know how that works for you. All right. And if you are not receiving Social Security or railroad benefits, you must enroll yourself into the plan. Even though still you can call us, we can give you some of the best tips, give you ideas about what you're about to get into. But you contact Social Security to enroll in A or B, and that's the number and website online. And honestly, about calling Social Security, don't call them the first of the month, don't call them the last of the month. And when you call them, be prepared to be online for a long time. Online is the best way to get them, to communicate with them, but I know a lot of people are not comfortable with doing it online. Automatic enrollment never includes the drug plan. If you're going original, they're going to automatically put you in A and B. You have to sign up for D. And there are, notice what I highlighted, there are lifetime penalties if you don't enroll in A, B, D, or C within the specified period of time. All right, so some other enrollment periods that everybody participates in: annual enrollment period or open enrollment, which we're heading into October 15th through December 7th each year. You can join, drop, or switch coverage, and it takes effect January of the following year. Now, what they really kind of confuse you is, so you can join an Advantage plan or original Medicare and a drug plan October 15th through December 7th. Now, in January through March, if you already have Medicare Advantage plan, you can change your Advantage plan. If you have original Medicare, you can't do anything. But January through March, if you have an Advantage plan, there's a Medicare Advantage open enrollment period. Only beneficiaries enrolled in Advantage plans can make one change during that 3-month period. They can switch Medicare Advantage plans, or they can go back to original Medicare, and the change will be effective the first of the following month. And all other enrollment periods, there's extra help enrollment period, and we're going to see what extra help is in a minute. And we love our acronyms. SEP stands for Special Enrollment Period. And use of your SEP is for extra help. If you get extra help, you don't have to wait for the annual enrollment to change your plan. You can change once a quarter, January through March, April through June, July through September, and changes are effective the first of the following month. After September, then you're in the automatic open enrollment, and it goes into effect the 1st of January. And then there are other special enrollment periods I lightly hit on. Like some people, I did this presentation at University of Tennessee, and there was a young professor there that was retiring for the first time at the age of 92. Okay, and so he had a special enrollment period that because he had never signed up, he was not being penalized because he had good coverage at work. acceptable coverage, they call it. So he was not being penalized. He had about 3 months from the day he retired to sign up. That's called a special enrollment period, and it is always dependent upon the circumstances. Okay, now let's look at what I've been hinting at. And these are the things that you hear all these commercials about, because these insurance companies make big money off of this. Medicare savings plans. These are federal programs administered through the state. And I'm sure you've heard of some of them. QMB, well, some of you all have, some of you may not. QMB, SLMB, QI1, and LIS, which is also called Extra Help. QMB, Qualified Medicare Beneficiary. I call these people the American Express Gold of Medicare Savings Plan. This is what they give you. They pay your monthly premium. That $148.50 they taking out the Social Security check. Federal government, the state pays that for you. The deductible, $203. That Part B deductible is paid for you. The co-insurance, the 20% is paid for you. The hospital deductible, if you have to go in the hospital, is paid for you every benefit period that you have to go in. Your drug premium is paid for you. If the drug plan you selected has an annual deductible, they pay that. Your co-pays are cheap. Your medicine can cost $100. Your co-pays rarely will go over $9.20 on brand, $3.90 or less on generic. Okay. You do not have to pay the 25% of the cost of your medication when you go in if you go in the donut hole. And we're going to talk about the donut hole in a bit. And you don't need any extra insurance. Not necessarily Advantage plan. You don't need a MEDICARE. You know, that supplement plan we talked about, you don't need that, because the state, if you qualify for QMB, they're going to pick that up for you. So now let's look at the next one. SLMB, Specified Low Income Medicare Beneficiary, as well as QI1. And I put these together because they have the same benefits. Now with these two, you don't get quite all of this, but you do get. Now, first of all, you have to have Part A to participate in this, which you got A, you got to have B. They're still going to pay that $148.50 for you. They're going to pay your drug plan premium. They're going to pay the deductible. Your medications are cheap and you don't have to go in the donut hole. What they are not paying is that 20% that Medicare. So you go to the doctor, now they're going to pay that $203 deductible. But Medicare then is going to pick up 80% on the original Medicare. It's going to pick up 80%, and you still have to pay 20% or get a supplement plan or completely go on an Advantage plan. And then QI1 does the exact same thing. So it's still a benefit. Paying $148.50 a month, that's a good thing. That comes to about $1,700 a year. All right, now the only difference between SLMB and QI1 is that QI1 has a special pool of money allocated to it each year. And based on how many people apply, it could run out. And it has a higher income qualification. We'll see that in a minute. And the last Medicare savings plan is LIS, a low income subsidy, which a lot of people call Extra Help. Now, some people think Extra Help is all of this, but this one is the one classified as Extra Help. Notice it is a medication benefit only, okay? Your Medicare Part D drug premium, if you have one, to be paid if you're on original Medicare. If they have a deductible, it'll be paid. Your co-pays will be low and you won't go in the donut hole. So it's still good. You won't go in the donut hole. They're not paying that $148.50, but you don't go in the donut hole. They're paying any drug premiums that you have. You pay co-pays of a very low amount regardless of what your medication costs. All right. And these are the ones, like I said, that you hear about on television all the time. When they say, we can save you $144 a month. Well, that's what the Part B premium was last year. And some of these companies don't even know enough to update it. It's $148.50 this year. And you get all this stuff in the mail. They can only save this for you if you qualify. And this is what it takes to qualify. In Tennessee, Medicare savings plans are administered through TennCare and facilitated through Social Security. To get QMB, you know, that American Express Gold, to get QMB, this is what your income has to be if you are single this is what it has to be if you are married. And not just if you're married, this is what both of you all's income has to be together. Okay. For SLMB, which is almost as good, it just doesn't pick up the 20% of your Part B doctor visits. These are the rates. QI1, notice it's a higher income level. Like I said, but this money also runs out before the end of the year. Resources in Tennessee and resources down here include checking, savings, stocks, bonds, cash value, not face value of your whole life insurance policies. It does not include your home or your vehicle, but it will include any home or vehicle you're using or as an investment, or what a lot of people get trapped on is a house or a car that they co-sign for because they don't live in it or live in the house or drive the car. It's considered a resource to them. So these are your resource limits. These are your monthly limits. This is your total resource limit for these items down here. LIS, your income limit is higher. Your monthly income limit is higher, but this is the one that's a drug benefit only, but that's a good thing. For single and for married, and then your resource limits are higher still for that. That's in Tennessee. In Mississippi, the Medicare savings plans administered through the Mississippi Department of Human Services through Mississippi Medicaid. And their figures, some of them are a little higher, some of them are a little lower if you're in Mississippi. And the thing that's wonderful in Mississippi is you don't have a resource limit. So you can have a nice sizable savings account and have this, a lot of times we can have much more money saved than we bring in every month. So you can have a sizable savings account with monthly income limits for married and single. Now for LIS, low income subsidy or the medication benefit is still the same, okay? All right, so this is what the big hype is all about. When people are saying, they just want you to qualify. They just want you to call. When you call, this is the first thing they'll ask you. How much money do you make? What's your monthly income? And if it don't fit these figures, they're gonna say, well, they're gonna try to sell you something else because they can't sell you that, okay? All right. So, and I need to mention that these figures also can go up based on family size. If you have a family size greater than 2, then your income limits do go up. This is not linear. If you got a family size of 6, they're a bit higher than what's shown here, or 3 or 4, they're a bit higher. Okay. All right. So I've talked about tips and traps. Now let's look at the best trick while waiting through all these commercials and mail outs. Now I have talked about mail outs, but there's 2 things that you get that's real. I know we have a tendency to trash stuff, but on Medicare, you will get your Medicare and You handbook once a year. So the 2022 handbook should be coming between September and October. And if you're already on Medicare, in September, you will get a document called, or a booklet called Annual Notice of Change. Pull that out your junk mail. That's not junk. The Annual Notice of Change, if you're already in Medicare, says this is what your plan is doing this year. This is what we're changing to next year. And you want to look at that because that's a lot of differences that people miss out on. But again, call us. We can help you through it. So there's a lot of things. Our question is so many options. What to do, what to do, what to do. Who and what should you listen to? All right. There are about 32 different drug plans in Tennessee and about 27 in Mississippi. There are about 38 different Advantage plans in Tennessee and about 22 in Mississippi. So to break that down, almost everybody knows somebody that sells insurance, okay? And we're not knocking that. People have to make a living. We're not knocking that, but we want our beneficiaries to be informed, okay? So look at the 5 different ways that you can get Medicare presented to you. 1 is an insurance agent. An insurance agent represents one company, just one. Now, that may be the best plan for you. It could be the best plan of all times for you. But remember, I told you, everybody's plans are different. your medicine, your doctors. But if that's the best plan for you, I can guarantee you, if it isn't, that's the only one you're gonna hear about. Why? Because that's the only one they selling. They're not gonna tell you about a plan they're not selling. Okay. Other way you can get an insurance broker. Now, a broker is licensed to represent several different companies, but you see how many different companies there are. They're not licensed to represent all these companies. They're not even licensed to represent both of these states. They're not necessarily licensed for all, definitely not licensed for all of these companies. And they're going to tell you, oh, it don't matter. The companies we represent are the best companies out there. Maybe, maybe not. And it may be the best company for you in one of those companies they represent. But again, it may not. But guess what? All the companies you hear about is going to be these that they represent. That's all. Like I said, not knocking people. We just want to educate you. So we can educate you, and then you can go call up your friend and say, okay, I want that one that you're selling. Because I talked to Ship, and it's a real, we selected, it's a real good plan. All right. The third and fourth way you can get Medicare is called 1-800-MEDICARE. Or you can go to Medicare.gov yourself, and we're going to look at that in just a few minutes. Now, we did get started late, so y'all have to give me about 10 more minutes or so. All right. But what is it that we like? The best trick on the planet is to choose Ship. All right. Why? Ship counselors educate you and help you select a plan by educating you without any profit, and we're not committed to or paid by any insurance agency. We don't get no money, okay? And here are the Ship numbers. And remember, like I said, this is going out on YouTube. We'll make sure you have the link. So any of these slides you need to go back to, you can go through, or you can even put your email. I'll put my email address in chat, and you can email me about different slides or information that you may want. But here's the phone number for 10 Ship. And for Mississippi Ship. Usually when you call, they'll take your information, and usually about 24 to 48 hours, a counselor will get back with you. Let's talk about the Ships for a minute. The Ships State Health Insurance Assistance Program, because the A not in there, but it didn't work for Ship if they put that. I don't know if y'all can see my shirt, but I have a 10 Ship shirt. Is that my little logo? They're funded by a federal grant. There are 54 ships or ship grantees. There's one in every state in the United States. And then they are in Puerto Rico, Guam, the District of Columbia, and U.S. Virgin Islands. Ships recruit and train both volunteer and in-kind counselors to provide program services. Ship counselors, whether we get paid or not, are highly trained and certified to help Medicare beneficiaries, their families, and caregivers. On the average, initial training is about 5 days, 6 hours per day. Then we have to do monthly seminars that can range from 30 minutes to 2 hours in order to maintain our certification. All right, so I want to look briefly at a Medicare plan finder. So you can see when I talked about going to www.medicare.com.gov. Oh, please, .gov, not .com. Definitely. Let's go back. It may be in it. Let's go here. So you go to Medicare.gov, and you want to go down here to where it says find plans, find health and drug plans. We're going to walk through one right quick. And it says you can log in or create an account. Yeah, I definitely recommend creating an account. This is the federal government. That's good. We're going to do continue without logging in. And it asks you a few quick questions. Do you want to learn about Medicare options? Well, we just got through doing that, hopefully, so we don't need that. And you can select original Medicare. Like if I do a drug plan, that means I'm looking at original Medicare with a drug plan. Or I can look at original Medicare with a supplement plan. I'm going to do an Advantage plan, not because it's the best, because the best is what works for you. Primarily, I'm going to do the Advantage plan because it encompasses just about everything we've been talking about. And it tells you it bundles all Medicare health benefits. It says with or without drug coverage, plus extra services like vision, hearing, dental, and more. We're going to do with drug coverage. All right, so I'm going to enter the zip code. I'm going to do Tennessee zip code first. And it asks, do you get help? Like, do you get any extra help? I'm gonna say no, just so we can see it without that. And click next. And I already added in some drugs. I'm gonna take this one out for a minute. All right. So I added in some of the standard drugs I tend to hear about when I'm counseling: amlodipine, lisinopril, pregabalin, if I'm even pronouncing that right. And I'll say I'm done adding drugs. Let me take this out. All right. And so then it says I can choose up to 5 pharmacies. And it says distance 5 miles. I kept trying to change this to 10 miles last night and it didn't want it. Let's see if it'll take it this time. Okay, well, we're not gonna do a survey today. Okay, it did 10 miles. I always select mail order. Sometimes mail order is cheaper, sometimes it is not. So it did, and then we'll add Walgreens, CVS. Notice they're adding up down here. I'm not gonna, let's see, we're gonna do Kroger, and we'll do this dedicated senior, whatever. All right, and I got all 5 there, and I'll say done. It loads the information in. We're in Tennessee right now, and notice there's 2 things. I can filter by the benefits, the insurance carrier, the drug coverage. I'm not going to filter by anything, but I am going to always sort. Sort plans by lowest drug and premium cost. Now realize this is something you can do. When you talk to us, this is something we do for you. We walk through this. So it brings up the plans with the lowest drug and premium cost first, not necessarily any plan benefits, but look, it tells you the benefits they provide. Because I told it I didn't have any extra help, so it's not giving me transportation. So it tells you this one, AmeriVantage, it includes health and drug coverage, and it said doesn't include the $148.50, which means you have to pay your $148.50. For the drugs we selected, look at it now. The drugs we selected, a retail pharmacy is $0. Okay, there is no deductible for health, no drug deductible. And you have a maximum out of pocket, which you don't get with original Medicare. So I said, yeah, let's look at that one. We're going to add that one to compare. Let me take off these others. Okay, so we're going to select that. And this one doesn't have a star rating. They're too new, so we're going to skip them. We're going to skip them. Let's see what Cigna has. They have a $0 monthly premium. The medicine we selected at this one will cost $10 for the year, the yearly drug and premium cost. Still no health deductible, no drug deductible. Out of pocket is $10,000 out of network, $6,300 in network. And that's for medical. Remember, this is the Advantage plan, all in one plan. So we'll add that one to look at. Didn't I add the other one? I think I took it out. The AmeriVantage. Mouse is having fun. And that to compare. And then let's scroll down. We got Cigna. And let's do Blue Advantage Garnet. That's owned by another big name, Blue Cross Blue Shield of Tennessee. No monthly premium. The medicine will cost $12 at retail. And there's your out of pocket. So we'll add that one to compare. You can only compare 3 at a time. So I got those 3 in, and I'm going to click compare. Okay, and it shows me the premium. And under the plan details, I'm going to look at here. The drug deductibles are $0, even though the maximum drug deductible this year is $445. For the medicine we chose is $0. There's no deductible. Your maximum out of pocket, your health premium, your drug premium, you still pay that Part B, $148.50. And then it tells you what else they have: vision, dental, hearing. Okay, don't tell you how much they pay for, they tell you each one that they have. It tells you your primary doctor visits. In network at Cigna, $0. AmeriVantage, $10 to go see your primary doctor. At Blue Advantage, $10 to go see your primary doctor. Specialist, $30 at Cigna. 0 to 45 with AmeriAdvantage, $35 with Blue Cross. And it goes on to tell you all of the different prices for x-rays, outpatient x-rays, urgent care, inpatient coverage. This is huge with Advantage plans. With original Medicare, you pay a deductible, $1,484. The next 60 days is free. With Advantage plans, they have per diem prices, generally for days 1 through 5, $295 per day for days 1 through 5 with Cigna, $350 at AmeriAdvantage a day, $300 a day with Blue Advantage, and then 0 for the next 6 through 90 days. You know, so that could be good. If you go to the hospital and only stay 2 days, if you got original Medicare, you're gonna pay the $1,484 unless you have a supplement plan. Then it goes to your hospital, talked about that, preventive services, extra benefits, dental, all of that. I want to get to drugs, okay? This is huge, drugs. They cover, this one covers all 3 of the drugs that we put in, but look at the price difference. Walgreens is preferred at Cigna. All your medication for the year, $10. Kroger is preferred, $10. CVS is not preferred. Okay, $47.50. It's the same medicine, just different at the different pharmacies. Walgreens under AmeriAdvantage, not preferred, $18.66. Kroger preferred, $0. CVS preferred, $0. See, CVS is preferred with AmeriAdvantage, not preferred with Cigna. These are the things, the little nuances that SHIP helps you see. That oftentimes when you're out there yourself, you may notice this, you may not notice this, all right? Mail order, $0 for Cigna, $0 for AmeriAdvantage, $12 for the medication at Blue Cross, okay? I'm gonna go back and do, and the biggest difference between here and Mississippi, in case if we're running low on time, is the same insurance companies may not come up, but the same process happens. The only other thing I want you to see with this, I'm going to add one more drug. It's the drug I took out. I'm going to add it back. Lispro insulin. There's a lot of people are diabetics and they're on insulin. We're going to add that drug back. Select the dosage. I'll say 100-unit solution, 10-pack vial, and we'll go with 3 vials every 90 days. And add that to the drug list. Okay. And we'll submit. And we're going to keep on everything else we got here. And stay done. Same pharmacies, right? Now I'm going to uncheck the 3 plans. Because notice, the same plans don't come up. I still have it sorted by lowest drug and premium cost. AARP comes up. You still have no monthly premium. Your drugs, $118.45 a year, which is not bad. Okay, and so we're going to add that to compare. Let's get past the AmeriAdvantages and see what the others do, even though they may be further down the list. Fine Cigna. A whole bunch of AARP. Cigna, okay. Notice that price, $504.71. That's a big price change. And you're going to see why in just a second. Let's see if we can find one more. We can find any Blue Cross out here. Because the further I'm going down the list means the higher the medication cost. I don't think Blue Cross even made it to this list. Oh, there we go. So I'm going to add them to compare. Okay, so we still got 0 cost for the plan. All that's the same. Let's scroll down and look at this medication. So AARP is covering it all 4 of your drugs. Notice these 2 are not covering all 4 of your drugs. They just covering 3 of them. I know, I promise you. And the difference is some of the insurance companies are not considered insulin friendly or diabetic friendly. So you see that price went to $504 for the year. That's still not bad for for insulin, but it went that high because they're not picking up on those 3 or 4 drugs. They're not picking up your insulin. So I'll get people call me and say, well, my friend got this one and it's great. Well, when we do the comparison, her friend didn't have diabetes and she's not taking insulin. So the prices were definitely different. All right, so that's our Medicare plan finder. Hopefully you all learned something from that. And the difference with when we look at Mississippi is the different insurance companies may change. All Advantage plans don't offer plans in each state. So let me see if I can wrap this up. We talked briefly about the donut hole. I mentioned that donut hole. This is on your drugs. If you have to pay a deductible, that's $445 a year. For that tier 3 drugs like the diabetic medication, you may have to have a deductible. For maintenance medication, a deductible usually doesn't kick in. Then you go through the initial phase, the coverage gap phase, the catastrophic phase, and let's see how that works. Donut hole, okay? Well, let's say the full cost of your medication is $1,000 and you pay $5 a month copay. So you pay $5, right? Who pays the $995? Your medicine costs $1,000. Okay, you paying $5. $995, your insurance company. Okay, what have you paid? In 4 months' time, what have you paid? You have paid $20. What have you and the insurance company together paid for your medicine? Oops, it jumped too quick. They done paid, you and the insurance company together have paid $4,000 in 4 months. Now, as you get ready to go into your 5th month, you in the donut hole because you done gone over the donut hole limit, $4,130. 5th month, you're at $5,000. So what do you pay now that you in the donut hole? 25% of the cost of your medication, which is $1,000 a month, or $250 a month. Now your medicine costs you $250 a month, and you paying $250. The insurance company is paying $750, and you stay right there. After 7 months, the total cost has gone over the amount that you need to come out of the donut hole, $6,550. And now you pay 5% or $50 a month while you're in the donut hole. Okay, but here's the thing. The donut hole starts over every year. Some people never go in the donut hole. Some people go in the donut hole early and they stay there, all right, until the new year, so they're not paying that much for their medication. All right, our final 2 things review is our senior Medicare patrol, who is all about preventing fraud and abuse, guarding your card. Don't give out unsolicited information to folk you don't know who you're talking to on the phone. Beware of people offering you free goods and services in exchange for your Medicare information. And the importance of SHIP volunteers. We've got approximately 2 million beneficiaries every year come on board with Medicare. 2 million. And without the 5,000 volunteers, that would be absolutely impossible. And this guy says when he's helping a senior, there is no greater joy he gets than a sense of relief on their face. And I as well. I love helping people save money. If I sound passionate about this, and I hope I did, I am. I want to help you make the best decision possible. This is some of the things that volunteers do. So y'all got some time on your hands and want to see about being a senior SHIP volunteer. We are here, but this is how you reach SHIP, Tennessee SHIP, Mississippi SHIP, any of the assistance that you need for the Medicare patrol. And I know I've literally chunked a bunch of information at you today. And I hope you got something out of it. Here is the YouTube link. Let me see. I'm going to put my email address in chat. And you have to get it before you come off of this. That's the one going to do it. Okay, I'm putting my email address in chat. If you don't get the YouTube link, and I'm gonna put the YouTube link in chat. Copy. All right, that you can go to and screen through and scroll through and find things that find some stuff we talked about that may be helpful to you. And I know it's late and somebody got to leave, you can. And hopefully y'all have some good questions. If not, you can email me your questions, but I'll be more than happy to answer questions. Like I said, I hope you got something out of as much out of it as I did. Pulling it together. All right. Questions. I'm gonna take a quick screenshot. But everybody smile. Well, I get the smiles. All right, Kevin, come on, let me take it again. All right, Doris ain't gonna come on camera. But please tell me if you have any questions, if you have a minute or two to ask questions. You're unmuted, Kay. Did I give you too much information? Is anything?
A lot of information. I'm just processing right now. I had great information, and I will have some questions. But I want to try to go through some of this stuff online and see how I do, but I won't quick spend yet.
Right. We will be talking next week. Right. Excellent. Anybody else have any questions? Don't tell me I gave you too much to even regurgitate back. Miss Doris, you there? And Miss Anna Marie. Kevin, you're not there yet, but you may have parents or family members. Any questions?
Oh yeah. Like before, when you went, can you hear me?
I can hear you.
Okay, yeah. Like we talked about before, when you gave this brief before, my wife is getting his Medicare, so I know pretty much because I helped her, work through the process and get her Medicare and everything started. So there's definitely that book, like you said earlier, that book you get, that is some good information. You can't just throw that in the garbage because you got to read that book. Yep.
Right.
So you know what you're entitled to and know what your coverages are and everything. So.
Right. And then this time of year, you're looking for the annual notice of change to come. Mm-hmm. And if you don't mind my asking, what plan does she have?
Well, she has TRICARE for life in conjunction.
Y'all got the best plan.
yeah, it's TRICARE for life because it's military. Yep.
Okay.
Yeah, so she don't have to pay any deductibles or anything.
Right, I know. Military folk, yeah. But you know what? We thank you for your service.
Yes, ma'am.
We thank you for your service. And Miss Anne Marie says she's in Louisiana. She's not close to 65, but she's enjoying and learning. Okay, well, great, Miss Anne Marie, to definitely know that there is a ship in Louisiana. When you get close, or you got parents or family members that get close, please talk to your ship counselors before you kind of get up with any of the insurance companies. So that's always a good thing. All right. Ms. Doris, you have any questions? You good? All right, she ain't gonna say nothing. Okay.
Yeah, I put
Alice.
Okay, now there she is. Yes.
Oh, hey, I have to figure out how to navigate this thing. I definitely did enjoy everything. Very thorough. And hopefully I won't have to call you 1,000 times this year.
Call me. You are always welcome.
Yeah, but I did. I even saved some of the screenshots with the information on it. So I appreciate it. Much needed, because I get frustrated every year when we do the open enrollment. I'm just frustrated every year. I hate it. But you did simplify some things for me. Thank you.
Awesome. Good job. Excellent.
Mm-hmm.
Thank you.
Mm-hmm.
All right. And Brother Kevin?
Yeah. I was gonna say I'm one of them insurance agents that you were talking about earlier. I'm not one of those. No, I just got my license in Mississippi, Tennessee, and Arkansas. So if just pass the word if anybody needs some insurance. I'm not one of them scam artists. I'll make sure they get what they need. So.
All right, good deal, good deal.
Yep.
Good deal. Okay. Well, if all minds are clear and all questions answered, and if everybody hopefully got now, I don't know if anybody, well, get my email. Make sure you get my email address out of there so that, let me do a screenshot of the who's on. Make sure you get my email address out of there, out of the chat. So if you got questions that come up later, or you want some specific screens that you didn't get a shot of, I'd be more than happy to send that to you as well as answer questions. Okay. All right, Brother Kevin, back in your hands, sir.
Okay.
Everybody okay?
Oh yeah, that's what I was gonna say. Yeah, my son is good. We got him a bunch of medication. He has asthma, so that complicates things. So it's a little tightness, but he's better now. He had to get a breathing treatment, and then he had to get a steroid shot. So we just made it back from the pharmacy getting all his medication. So he's getting better now that he got the medicine in him.
Excellent.
Yeah.
Excellent.
Yeah. So and then nobody's positive COVID, so we got that test as well. So we good. We're all negative.
Praise God.
Yeah. Yeah, Alice, I really appreciate you taking the time out of your busy schedule to do this brief for us today. It's very informative. I hope everybody got some valuable information out of it, because it definitely is a lot of information. So, like I said, when you get that book, don't throw it in the garbage, because everything she covered is in there.
Yeah.
And plus some. So it's definitely good information. So if nobody has any other questions, all minds are clear, I would like to close out with a scripture and prayer.
Yeah.
Okay. I want to come to you from Psalms 42 and verse 11. Why are you cast down, O my soul, and why are you in turmoil within me? Hope in God, and for I shall again praise him, my salvation and my God. Let us pray. Heavenly Father, thank you for this day you have made for us, and thank you for bringing Ms. Alice Waller to us to give us this valuable information on Medicare. I hope everybody's mind was clear and open to digest as much as they could with this presentation, but continue to research and find out as much as you can about Medicare. And Heavenly Father, I pray that everyone it remains healthy, and as great as possible, so they won't have to use this Medicare as often as they are now. In your name we pray. Amen.
Amen. Thank you, everybody. Y'all have a blessed and safe day.
You too, Allison. Once again, thank you.
All right, you're welcome, sir. All right.